Welcome to another Wellness Wednesday. I am so glad that you're here. I'm Dr. Thema Bryant-Davis, and our focus on today is trauma-informed applications to rebuild and recover. I'm so excited as we think about being trauma-informed as psychologists that I was able to gather on today three of our wonderful experts in the field. And the first one is Dr. Carolyn Allard, who is a professor and program director of the PhD program at the California School of Professional Psychology at Alliant International University, and has an appointment in the Research Service of the Veterans Affairs San Diego Healthcare System. Prior to her current position, she served as program director of the Military Sexual Trauma and Interpersonal Trauma Clinic and the San Diego Advanced Fellowship in Women's Health for over 10 years at the VA San Diego and University of California, San Diego Department of Psychiatry, where she was associate professor. Dr. Allard is a licensed psychologist and has her board certification in clinical psychology, and she has extensive experience in clinical practice, training, and consultation, with expertise in the treatment of trauma-related conditions. She is also an active researcher focused on the identification of individual, sociocultural, and contextual predictors of post-traumatic distress and treatment outcomes, with a specific interest in trauma-related guilt and shame, and the goal of developing and testing interventions to address these factors to improve outcomes. Dr. Allard is also engaged in professional and public education and social advocacy. She is a past president of the American Psychological Association's Trauma Division, Division 56, with the mission of bridging culturally informed trauma research, practice, and advocacy to effect positive change in our local and global communities. Welcome, Carolyn.
Thank you. Happy to be here.
Oh, wonderful. We're glad to have you. And our next guest is Dr. Usha Tummala-Narra, who's a professor of counseling, developmental, and educational psychology, and director of doctoral training in counseling psychology at Boston College. She is also an independent practice. Her research and scholarship focus on immigration, trauma, race, and cultural competence, and psychoanalytic psychotherapy. She has served as the chair of the Multicultural Concerns Committee and member at large on the board of directors in American Psychological Association, Division 39, Psychoanalysis, and as a member of the APA Committee on Ethnic Minority Affairs, the APA Presidential Task Force on Immigration, and the APA Task Force on Representing the Multicultural Guidelines. Dr. Tummala-Narra is an associate editor of the Asian American Journal of Psychology, associate editor of Psychoanalytic Dialogues, and senior psychotherapy editor of the Journal of Humanistic Psychology. She is a fellow of the American Psychological Association and with APA Division 39 and Division 45. She is the author of Psychoanalytic Theory and Cultural Competence in Psychotherapy, published by the American Psychological Association Books in 2016. Her edited book, Trauma and Racial Minority Immigrants, Turmoil, Uncertainty, and Resistance, was published by APA Books in January 2021. Welcome, Usha.
Thank you so much, Thema. It's great to join you.
Oh, I'm glad that you're here, and congratulations on the new book.
Thank you.
Relatively new, 2021. And thirdly, I'm honored to present Dr. Robyn Gobin. Dr. Robyn Gobin is a licensed clinical psychologist with expertise in interpersonal trauma, the cultural context of trauma recovery, and evidence-based treatments for post-traumatic stress disorder and other trauma-related conditions. She directs the Transforming Trauma and Mental Health Research Laboratory in the Department of Kinesiology and Community Health, where she is a tenured-track assistant professor. Dr. Robyn's research investigates how individual, cultural, and societal factors lead to unique mental health outcomes among ethnically diverse trauma survivors. Over 30 publications in peer-reviewed journals, and her work has been supported by the American Psychological Association, the International Society for the Study of Trauma and Dissociation, and the Patient-Centered Outcomes Research Institute, A nationally recognized expert on interpersonal trauma and women's mental health, Dr. Gobin has over a decade of experience as a trauma therapist, supporting survivors along their healing journeys. Welcome, Robyn.
Thank you so much for having me. So excited to be here with all of you.
Oh, excellent. Well, I just appreciate the work that you all have done in the field, and it is relevant at all times, but especially at this time. So I want to start off the dialogue by just asking you to each share from your perspective, what is trauma and what are the ways that you have seen the effects of trauma in those that you serve, whether in your clinical work or in your research. And I will start with Dr. Usha.
Okay, well, this is such an important question and so relevant to the past year and a half, as we've all seen. You know, to me, trauma is a response, right, to a very distressing, disturbing, and sometimes extraordinary event, something outside of typical human experience. And it's a situation where we experience helplessness, a loss of sense of control over what's happening to us. And it can be something that we experience either short-term or long-term. It can have a lasting impact. And it can also have a more immediate impact. So it's multidimensional. There are a lot of different aspects to what trauma looks like. And over the past year, what's been interesting and very sad for me to see is just the level of isolation that people have experienced in the context of experiencing trauma. So it's not only trauma and COVID adding to this isolation, and also, I think, bringing to the foreground the immense disparities that exist with regard to healthcare and access to healthcare and just health more broadly. It's an awakening to the racial injustice and social injustice that we've seen for a long period of time, but there's a certain kind of awakening around that. And along with that, a cumulative set of traumas related to race, immigration, sexual orientation and identity, social class. And I think there's and the interpersonal trauma. It's interesting because it's also a time where we've seen survivors of interpersonal violence feeling more trapped than usual. You know, where do you go when you have to socially distance? So these are some unique layers over the past year and a half that I think really stand out for me, in addition to kind of the broader context of trauma and traumatic stress.
Yes, thank you so much for raising those different pieces and the ways it can show up. And then, as you said, dealing with it in the midst of isolation. Dr. Carolyn, if you can speak to us about, from your vantage point, what is trauma and what are some of the effects you're seeing? And if you're frozen, I'll come back to you, or did it unfreeze?
I'd love to, and I apologize in advance because my internet's a little spotty. So if you stop hearing me on.
Okay, we will go to Dr. Robyn and come back, and we understand, Dr. Carolyn, as all of us have been dealing with internet issues, so it happens. Dr. Robyn.
Yes, so I agree with a lot of what has already been said. You know, I think about trauma as an experience that really taxes our typical coping capabilities or typical coping strategies, and it definitely requires more of us than just typical daily stressors. And again, trauma can be multi-layered. And I think a piece that becomes challenging with trauma is that all of us did not receive, a manual on how to cope when we experience trauma, right? And so we're all just trying to navigate when we are exposed to trauma, trying to navigate, how do I deal with this? And I think a lot of what comes with that is a feeling of loneliness, or a feeling of questioning yourself, like, what is experience? Should I just be able to get over this? I know that's been a lot of what I've heard from clients, like, it's been years or it's been months, like, why am I not over this now? So I think it brings a lot of feelings of questioning oneself and questioning one's identity and questioning one's capability. But something that I like to tell people all the time is that you're not supposed to know how to cope with trauma. You're not supposed to know how to overcome it by yourself. It's not a normal experience that we should have as humans, but it is, we know, really common for people to be exposed to trauma, unfortunately. And so something that I've definitely seen in this last year has been a lot of people questioning their identity, a lot of people questioning how they reconcile the person who they were before the trauma happened with the person that they're becoming now that they have learned to heal from the trauma and started to cope with some of the symptoms. And so that's what I've really been seeing, and have been really noticing a lot of attention going towards community trauma, because I think traditionally in our field, we've been really focused on trauma at the individual level, and we've not thought as much about how trauma has impacted communities and how communities have experienced collective traumas that they're still trying to heal from. And so I think that that's something that has a spotlight has been put on that in the last year, and I've been really happy to see that, because I think that that has brought researchers and brought clinicians to the forefront, trying to think about, like, how do we heal communities? How do we help communities heal? Because we know that a lot of the traumas that occur happen in relationship. And so I think it's really important for healing to occur in relationship as well. So I will just pause it there.
Thank you for speaking to that, both the individual and the collective. And Dr. Carolyn, we'll see if your internet will cooperate. And as I said in the moment, we have all experienced it, especially during these times. So how you think about trauma and the effects that you've been seeing?
I'm afraid my internet is still spotty, but I'll give it a shot.
Okay.
Can you hear me?
Yes, we do.
Okay. I missed some of what Robyn said, but I got the tail end, and I would just like to echo what both Usha and Robyn said, and would add that the other trauma we're seeing is the fear of trauma, is the fear of things happening, of discrimination, of racism, of violence. The fear of trauma is traumatizing in and of itself. And I don't know if you all watched the recent ISDSS panel discussion on criterion A of our PTSD criteria by Brian Marks, Paula Schnurr, Brittany Hall-Clark, Paul Holzheimer, Matt Friedman, you know, some of whom were part of the last iteration of our diagnostic statistical manual on PTSD and how do we define trauma. And it was really heartening to see them, sort of admitting that we don't have it down. We don't know how to define trauma. It's so complex. It's so multi-layered. It's very contextual. And if you don't consider all of the different layers and context, including historical context, you're missing the mark. And it was really heartening, like I said.
So it's cutting off now, but the points that you made are really important in terms of those who created the criteria, talking about the challenges of even defining it and the importance of paying attention to context. And so I want to ask now, what does it mean for a psychologist to be trauma-informed? And I'll start with you, Usha.
Yeah, I love the points that both Robyn and Carolyn have raised. Just to dovetail a bit on what Carolyn just raised in relation to your question, you know, how can we be trauma informed as psychologists? I think part of it is how we define trauma. And so I love the first question you raised, Thema, because I think that's actually central to, you know, really what we ought to be doing as psychologists is really thinking about what actually does compose trauma and really rethinking that. To date, you know, we really don't have a contextual definition of trauma outside of, you know, looking at sort of some issues like patriarchy that might contribute to interpersonal violence. I think we've, you know, explored that area pretty significantly, but we haven't explored other areas. And I think to become trauma-informed psychologists, we have to ask ourselves and continue to explore other areas, including, you know, things like racial trauma, sociopolitical trauma, deportation trauma, being separated from families. And by that, I mean migration and immigration in that context, but also families have been separated from each other all the time in the United States outside of the migrant context. We have child protective services, we have foster care systems. There are, you know, many different contexts that I think are largely unexplored in psychology that we need to start paying attention to. So when we say we need to become trauma-informed psychologists, we're actually still developing our own understanding of trauma within psychology. And I think we need to do a lot more collaboration with a variety of different communities to really understand the variety of experiences of trauma, both in that collective sense that Robyn had pointed out, but also within groups that there are variations. So individual families, individuals themselves experience those collective traumas differently. You know, we look at refugee families and people in exile and how differently 2 or 3 siblings within a family experience trauma differently, how they define trauma differently. So I think these are areas to explore that will help us become better informed as trauma focused psychologists.
Thank you. And it's important as you were naming, you know, the different types of trauma, right? Because what does it mean if someone says they're trauma informed, but trauma informed on this smaller, narrow view of what trauma is, right? Then they can overlook the experience of the people they are supposed to be serving. And Carolyn, how would you define what it means for a psychologist to be trauma informed? Oh, you're muted.
Okay, I absolutely agree with what you just said, and it is a great follow-up question to how do we define trauma, because we can't be trauma informed unless we actually appreciate the complexity and the broadness that is trauma. I think to me, like being trauma informed really just means being contextually informed, right? It means taking into account all of the experiences and context of an individual, you know, as we develop, as we assess, you know, what's going on, as we formulate a case, conceptualization, as we do some treatment planning, and also just in our relationship with others, whether it's a client or somebody else, right? And it's a really person-centered, therefore, and strengths-based approach that's validating, and I think ultimately more effective in our approach to relating to others, again, in and out of the therapy room. So, like, for example, if we're trauma informed, when we're asking questions like, what's happened to you versus like, what's wrong with you? I think, you know, a lot of people are kind of catching on to that in the public now, and it's really nice to see. But like, you know, other examples would be like, what's going on right now that's not working for you? And what are some things that you or I or we can do to make things better versus what are you doing wrong that we need to fix, right? Or otherwise blaming and invalidating, you know, the victim or folks. And so I think it's really taking a bigger picture approach to like assessment and case conceptualization, and therefore we get a clearer, more comprehensive, and ultimately more accurate picture of contributors to whatever's going on with a person, with an institution, with an organization, and therefore a better picture on how to address these things, any issues that come up, and make things better.
So important. That's really good as we think about not only like being informed and aware, but then as you said, how do we make things better, right? How do we intervene? And Robyn, what would you say?
Yeah, I agree with everything that's been said thus far. I would just add, in addition to context, how I think about being trauma informed is really taking the whole individual into account. So I know a lot of times if someone comes in and they have a trauma history, it might be someone's tendency to focus on, you know, PTSD symptoms or just to focus on like circumstances surrounding the trauma. But I think really looking at someone's life, because we know that trauma really does cause people to question their identity, who they are, how they view the world, all of that. So I think taking the person as a whole and really kind of thinking about what did they experience, not only in one traumatic experience, but the various traumas perhaps that they've been exposed to throughout their life, and how has that impacted all areas of functioning with them, and really again trying to have a comprehensive understanding of what they've experienced and how that has influenced their thinking, their behavior, their emotions, and just their habits and their behavioral tendencies, and how it's also shaped the community that they're involved in, and how we might be able to help them to address some of the challenges that they're having. Again, as folks have said, from a strengths-based perspective, so not only looking at what they need to do differently, but also like how the environment needs to shift to support their healing and their continued growth and to help them thrive in their lives.
Excellent. And that's part of our theme and my commitment is moving beyond surviving, but also this piece of thriving and growth. And while we attend to being trauma informed as individuals, I want to expand that to ask, you know, what does it mean for an organization to be trauma informed, whether we're talking about a counseling center as a whole, or whether we're talking about an organization like APA. So Usha, what would you say about being a trauma informed organization? And for those that may be listening who may be heads of organizations, like how, if you are not already, how does an organization become trauma informed?
Yeah, I think about the kinds of research as one example that could be expanded, you know, that oftentimes, you know, the funding that is given to research on trauma is not contextualized, you know, it's not contextualized research. A lot of times it focuses on biological factors, it focuses on what I would say is very traditional thinking about trauma, and not really looking at different paradigms of conceptualizing trauma or healing from trauma. So I would think organizationally that we could create better funding structures to support research that would expand our understandings of trauma. So we're all talking today about how do we learn more about how trauma is defined and experienced by different communities and different types of trauma, what they can be experienced as. And we don't have enough data on that from a research perspective. We hear it in the clinical setting, we hear it from communities if we are practitioners, but researchers tend to not hear that more directly. So there's this kind of disconnect, I think, oftentimes between what happens in research versus practice and community-based education and collaboration. So I think that's one thing that APA or institutions, colleges, universities, training programs can certainly invest in. So the other thing I would say is that there's often a disconnect from the impact of the broader socio-political climate on both practice and research. And so I think that organizations can do a better job of trying to integrate these things and not sort of see that as some kind of external factor that you kind of have to put aside and the real trauma is somewhere else, you know, but the interaction of individuals within a socio-political climate, I think that's an area that institutions certainly can focus more on.
Absolutely. Thank you so much. And Carolyn, what would you say about institutions being trauma-informed?
I am so thankful for Usha's comments. I absolutely agree. And I think I think that we do need more research that's more expansive and less sort of status quo research. And I don't think it's due to a shortage of researchers and research interest. I think for a while it's been sort of limited due to funding agencies and their sort of, status quo sort of mindset. Like you said, more looking at more biological aspects, which are all very important stuff, but it's sort of been limited to that. And it's, again, heartening to see this movement towards sort of more expansive research, but also like funding it and kind of putting our money where our mouth is. And so definitely we have a long way to go. And it's nice to see that there's this shift happening. They're never as fast as I would like them to be, but they're there, and I have to remind myself. And that we need to also, as researchers, as clinicians, as people who work with trauma and experts in the field, to really keep pushing the big funders. And I know NIH is moving in this direction, and certainly we have smaller sort of funding agencies, funding sources that are kind of moving in that direction as well. In terms of the initial question of sort of how do we make organizations trauma informed, I think it's much in the same way that we make ourselves trauma informed and clinicians trauma informed, right? It's like, what are those kinds of questions that we're asking about what's working in the organization, what's not, and what we might be doing that's harming people in our organization, and sort of taking, again, a more comprehensive, expansive view and approach.
That's so important to consider, not only the possibility of erasure or neglect by not paying attention to trauma, but also what you just spoke of doing harm. That sometimes our practices can actually be re-traumatizing. So being tuned into that. And Robyn, what would you add?
Yeah, again, agree with everything that has been said thus far. I would add something I think about when I think about organizations is just remembering that there are people who are helping the organization work towards the mission. I think sometimes organizations have this kind of big picture, and so they're focused on the mission and focused on kind of getting things done and reaching milestones. And the higher ups forget that there are individuals who have lived experiences, who have trauma histories and backgrounds that are working towards that mission. And so just not forgetting, not treating people as humans, but treating people as humans, right? Not treating them as machines is what I wanted to say. Not expecting things from them that are just not really realistic. And when people are struggling, really taking the time to hear what their experiences are, and really trying to see how the policies, the practices, the procedures that the organization has set can be more trauma informed and can be more sensitive to the experiences of these real human beings that are working for you. Because I think it really, a lot of times organizations can get caught up in just meeting the milestones and pushing people as if they were machines, and not really seeing the people behind, the numbers are behind the mission. And so I think that's a huge piece of that trauma-informed piece, is really understanding that you have individuals and understanding their experiences, and making sure that the policies, the procedures, the practices are trauma-informed in that way.
So important, as you named, that humanity, because often organizations, institutions, systems are expecting just kind of these machines to like do what they're told, do what they were hired to do, what they're plugged in to do, and absolutely ignoring context and what people are living with and dealing with and coping with. And so being really mindful of even how we set up and structure the systems, because often what I found when institutions will bring me in to talk to employees about self-care, they get very uncomfortable when I talk about the system's responsibility. They want it to just all be on the shoulders of individuals. And I know we have mentioned both practice and research, but there are additional ways that psychologists can help to address issues of trauma. And I'll just reverse the order this time and ask Robyn, what are some other ways that psychologists have been helpful beyond individual therapy or research studies, and either ways that we already have or ways that we could be helpful in addressing the trauma, the pandemic, and other traumas that people are dealing with.
Yeah, I would just say the thing that comes to mind for me is doing what we can to reduce the stigma around mental health, mental illness, and also around therapy. So I think some of the pieces actually, Thema, that you've been involved with in, media and really kind of speaking, giving interviews, helping people to really see what it's like to be in the room with the therapist, or helping people to understand how prevalent and how common mental health issues are, so that people don't feel alone and people don't feel like they have to hide their true experience if they're struggling or dealing with something. So I think us speaking more in non-academic public spaces where individuals who may never step a foot in our therapy room can really hear what these experiences are like. I think another way is writing in a way that the public can digest it and can make sense of it. A lot of the journals that we write in, I don't think the public is waiting in line to read those articles. They're very complex sometimes and very higher level. So I think reminding ourselves, like, the science that we're doing, the research is really meant to have an impact at the community level. And so how are we disseminating that to the community in a way that they can actually digest it and benefit from it? So I think, writing public facing books, speaking in the media, giving interviews, doing podcasts, so utilizing these kind of social platforms to really, again, spread the knowledge that we know, so that people who are in the public, the lay public, can understand the information, so that they can then make more informed decisions when they do have exposure to trauma, or have a family member that's struggling. They can provide advice that is science informed, because they've heard it from us and they've been able to garner that information and use it to better their own well-being and the well-being of their community.
Yes, I really appreciate that range, and you have been a great example of that. I often recommend my clients read your book, The Self-Care Prescription, and you have updates as well, but making it accessible. I remember when I used to work at a university counseling center, and we would get an influx of clients when we would go out to like community events, because people would say like, oh, I would never talk to a therapist, but I would talk to you, right? So it is being present, right? Being present so that it's not such a mystery, removing the stigma and the mystery of what this is. And Carolyn, what might you add?
Well, I would definitely second that, and I think one great way is doing exactly what you are doing, Thema, and I'm so very grateful for you and all that you do to educate the public, and for doing it in such a creative and compassionate and generous, and I might even say like joy-filled and hope-filled way, and really like making it accessible. And I think, for all the sort of grumbles we might have about social media, I think there's so many other people like Robyn, yourself as well, and other people. It's just sort of destigmatizing and making it more accessible, and like letting people know, like, a therapist looks like me and you, and we talk just like you, and we have the same concerns and needs and wants, and sort of just personalizing it makes it so much more accessible. Not being as eloquent myself, both written and orally, like, I do make it my mission personally to educate every and anyone who will listen about trauma and its effects, and also to role model sort of being vulnerable and talking about issues and stressors I might have and difficulties I might have, and role modeling taking a trauma-informed approach to my relationships and projects I might be leading, and my leadership roles. So whether in the personal or professional sort of arenas. So I think the more people that do that, the more the more we reduce the stigma, the more we make it accessible to folks. So those are my thoughts. I'll stop rambling.
I love that. And it is true, the power of our disclosures, right? That again, we're not these blank slates, but living human beings that are in the midst of this pandemic as well as, you know, other forms of stress and trauma. And so it can be empowering, and that transparency is also like contagious and gives people permission to be more vulnerable and authentic. So yes, I love all those. And the piece you mentioned with social media, it's like, yeah, it's a tool like everything else. So it's definitely some research that'll say, depending on who you're following, that you could go on there and end up feeling worse about yourself. Or if you're following people that are saying things that are informative or inspirational or that connect you to resources, then it can, you know, be empowering. So really important. Usha.
Love what both of you have shared, all three of you have shared, and I totally agree that, Thema, I so admire what you've been offering the public for so long, and in that hope-filled way that Carolyn has mentioned, and Robyn, what you said about addressing stigma, you know, and just how to normalize, working on normalizing seeking help rather than making it about, well, I only go to see a therapist if I'm in a crisis or if something's really, really bad. I guess the only thing that I would add is around how psychologists, I think, have contributed to the context of schools around mental health. And I think there's something more we can do with that around trauma-based education in places like schools. I'm just using schools as one example, like K through 12, but I think there's a lot of misinformation or distortion around what trauma is like among kids. And I don't know that our teachers are supported in really being able to address some of those issues that communities face, families face, that children face, and how that impacts their education and their school experience, their sense of belonging within the school. And so I know we have a lot of focus on bullying at the moment, you know, within psychology, which has been really important, but also think about things like curriculum and, you know, how can psychologists contribute to making systemic change in what we learn, and how can that contribute to changing stereotypes and understanding between people, the humanity of people, and humanizing everyone who lives in this country, you know, and globally. And so there's, I think, a lot that we can be doing in terms of connecting with school boards, getting more active politically as well, because we have a lot to offer. And I see so many gaps in education that then affect mental health well into adulthood and beyond. And so we have a systemic trauma around education that I think we could be contributing to as well.
Thank you for raising that, the education system and, you know, the impact on our kids and the importance of recognizing the way we can apply our science to inform policy. And around our advocacy, you know, often if we only talk among ourselves, we assume everybody has the information we have. And, you know, here in Los Angeles, I've become active with our neighborhood council, which works with the city council. And on issues of education or equity, you know, there's just often, you know, these gaps in the conversation that, you know, when I share that the psychological piece, it's new information, right? It just has not been at the table. So we definitely have a contribution to make. As it relates to individual psychotherapy, while we talk broadly about being trauma informed, I'm also aware there are multiple approaches, and I just like for people to hear some range of those approaches. So if there is one you are more partial to, if you could just explain a little bit about what it means to treat trauma from that perspective, whether it's psychodynamic, EMDR, trauma-focused CBT. And I think, interestingly, not only can that help to educate potential clients, but also those of us in the field, because sometimes people only know the one they were trained in and don't have a real understanding about how other people are working. So Usha, I'll start with you this time.
Okay, so I tend to take a psychodynamic approach that I would say is integrative of culture, context, and feminist principles. And so I look at it from those perspectives. And what I find many things helpful about that approach, but I'll try to highlight a couple of things. One is the freedom that this particular approach gives me in exploring traumatic experience at multiple levels. And for example, what is happening in the present and in the conscious level, but also what's happened as a culmination of a lifetime of experience from the past into the present. So there's this kind of shift that goes on in my work between the past and the present, paying attention to both conscious and unconscious life that I think is shaped by trauma, and that informs how a person comes to see themselves and other people and their relationships in the world. So the approach allows me to kind of engage with all of those different levels. It also allows me to think about unconscious processes that are shaped by broader contextual issues and one's personal experience of context. So if somebody has experienced a racist incident or a lifetime of racism, how is that impacting who they are today and how they go about trusting other people? How do they make decisions in their life? What do they feel limited by? What do they feel hopeful about? So really trying to think about what is underneath. For example, some of my clients will say, well, I know that this incident happened, but it happens all the time. And it's happened to my parents. It happens to me. They dealt with it. Why am I so stressed out by it? You know, so this idea that I should be over it, you know, and it's not a big deal. I should put it aside and keep going. Really not recognizing that, in fact, it's okay to be stressed out by what you've experienced, you know, that's a real thing. It's not something to be dismissed. And yet at the same time, you've also survived it and you continue to survive. And so how are you doing that, you know, and what is making that possible? So again, a lot of that is connected to the messaging that a client might have been told about what they should sort of put up with, what's just normal or normalized, but also what they've internalized at an unconscious level about life, about themselves, about the world. And, you know, so this approach sort of allows me to dig into all of those realms. And also it allows me to kind of think about the relationship between me and the client in a deeper way, in my view, where there are certain feelings that come up towards me, or that the countertransference that I might have towards them. And in doing trauma work, there's a lot of powerful feelings that come up, and for both of us. And so it allows me to kind of reflect and process that, both from conscious level as well as an unconscious level. So those are some reasons that I think this approach is helpful.
Yes, really helpful. And thank you for naming that integrative piece as well, because I think often when people hear psychodynamic, they're not aware of those who are working from that lens in a contextualized way, right? And so very important. And Carolyn, can you give us information about maybe one approach?
Yes, although when you first asked the question, I kind of understood it in this slightly different way.
Okay, however you want to share.
But I'll just say quickly that I've been trained in lots of different approaches. I mean, mostly CBT based, but you know, third wave, including DBT and ACT, and have treated post-traumatic distress using these different kind of protocols, but they're all underlying CBT. But I've also learned a lot about psychodynamic approaches, and I have colleagues who use that approach. And the more I learn about these different approaches, the more I realize they're all kind of underlying, you know, have the same sort of underlying commonness. And the way that you were describing your approach, Usha, really, like, I could have been just saying the same thing from a CBT perspective. So I think it really captures, you know, the essence of how we work with trauma in a really nice way. And like you said, you know, it's important to be contextual and to be comprehensive and sort of look at the person as a whole person and their whole experience. And the piece that I was going to say, like that in my therapy session, this like sort of approach that I find to be the most helpful as a clinician is not necessarily the specific protocol that I use, but that it involves like this great amount of just knowledge sharing, like psychoeducation, like can be so validating and empowering. And like, I don't hold anything back. I share everything I know. There are no secrets. Like I don't have the secret, you know, magic wand that, you know, I'm going to keep to myself, close to my chest. I just teach people what I know, how I know, you know, what we know so far about how the science tells us, like so far, and my clinical experience tells me so far how trauma works, how it affects people, and how we can recover from it. And I just work with them sort of in this coaching kind of way. And often just hearing some psychoeducation, like hearing that they might react in a certain way when, you know, somebody they're dependent on perpetrates abuse against them, because they have to maintain attachment to that caregiver. And, you know, when they're outside of that context, it's no longer effective for them. And so we just need to sort of discover how else they can be in the world. It can be incredibly, incredibly impactful. And sometimes that's all you need to do, right? And so I think that's my one gem of that I can share with people that I find to be really important in clinical work with my clients.
Thank you so much for speaking to, you know, even the commonality, right? That, you know, sometimes our languaging or even part of the frame can be different. And then, as you say, when you dig down, you can also see a number of ways that it overlaps. And, you know, I think we can miss that. And that's one of the things I try to encourage in our graduate students, to not like fall into that trap of like, my way is, you know, this one way is the only way. Robyn, what would you say?
Yeah, much like Carolyn, I interpreted the question as being like a one nugget of like something that I do across therapy sessions. So I'll answer it that way. But I will say, you know, I've been trained in a number of different ways of addressing trauma, mostly CBT related pieces, as well as, you know, contextual ways of looking at and thinking about trauma and its effects. But something that I've found super helpful across like trauma clients, no matter what kind of integrative approach that I'm using, is just slowing the process down and creating space for people to breathe. Like I find that trauma definitely has a cognitive impact. There's often a lot of thoughts that are racing through people's minds. And in the world, we often feel like we have to perform, we have to be on top, we have to have the right answer. And so in my therapy sessions, I really just like to give people space to like really process and just breathe and allow the breath to kind of be nurturing and allow there to be space where they don't have to feel like they have to have the right answer or they have to perform in the session. And I've just found that, you know, you see people's shoulders, you know, get a little bit lighter and they feel that, you know, that they can just be and really make sense of what they've experienced and really start to see connections and themes about how the different experiences they've had throughout their lives have impacted the way that they approach the world and the way that they tend to react or engage with others. And so I've just found helping people reconnect with their breath and utilize that in moments where it feels like they have to have an immediate response helps them to really see what's really happening in the moment. I'm a huge proponent for mindfulness, so not kind of reacting to what your mind is telling you is happening, but really being able to stop and pause and see like what really is happening. Like, is this a narrative that's playing in my head right now, or what really is important in this moment for me to respond to, and what is going to be the most nurturing response that I can offer that's going to help me in the long run and be best for me in the long run. Because I find also that oftentimes trauma survivors are really situated to really look at what other people need, and they, you know, are people pleasers sometimes because that's what they've had to do to survive often, especially if they've experienced interpersonal trauma. So helping them reconnect with what is helpful for them as well as what's helpful for others, and prioritizing their own care and their own emotional needs alongside taking care of other people.
That is so important, the breath and not having to prove, because often, the trauma really makes us feel like unworthy, like not enough. And so getting caught up in the busyness or the perfectionism, being anxiety driven, where if I'm doing enough, maybe I'll be enough. And it can be really radical to be still, to be still and not have to perform. And I'm aware of our time, but I do want to ask what your thoughts are about not only focusing on symptom cessation, like, reducing depression, anxiety, PTSD, but about these notions of like growth or post-traumatic growth or thriving, and how you see those. And Robyn, I'll start with you.
Yeah, I definitely see thriving as a goal that I have for all of my clients that I want to see them get to, right? So not just surviving, not just the absence of PTSD symptoms or depression symptoms, but really helping them to think about their life and think about what they want to stand for, what they want their lives to be about. Like, what is the story that you want your life to tell? What is the legacy that you want to leave? And how can I help you to move in that direction? And how can we remember and honor that trauma definitely will always be a part of that story, but it doesn't have to be the focal point of the story. And so helping them to think about what they want for their lives, what kind of relationships they want to see in their lives, and what they want to accomplish, who they want to be, and helping them to move in that direction where they're really connected to other people, connected to larger values, and really just designing their own life rather than allowing life to happen to them.
So important. Thank you for speaking to that. And Carolyn.
I really don't have anything to add to what Robyn just said. I think that was beautiful.
Yes, well said. And Usha?
Yeah, I think I love what you said, Robyn. I agree totally. I think, the only thing that I could say in addition is just that, trauma sometimes limits people from making meaning out of their experience. And I think sometimes when we focus only on the symptoms, we don't think about sort of as Robyn mentioned, the whole person, right? The humanity of a person, their spiritual life, the way they sort of think about the world. And that's really, really critical, I think, in the healing process. So that's something I care deeply about, moving beyond the symptoms and into thriving, but also finding meaning and purpose in one's life.
Yes, so important. So for our final question, you all will have an option between the last two. So if you can either share a resource that you would recommend or a protective factor that is helpful for people in the aftermath or while we're going through this trauma. And I'll start with you, Carolyn.
I'll answer one very quickly and then the other one almost as quickly. One is I think it's that having supports around you are really important. I've seen folks go through treatment with lots of varying degrees of support. And if they have at least one person that's on their side that's cheerleading, that can make a tremendous amount of difference. And if I could recommend a resource, can I recommend three? I'll just do quick. One is obviously Robyn's resources on self-compassion, self-care for both therapists and clients. I recommend that highly. Trauma work is very difficult. Going through trauma is very difficult. Just being aware that there's trauma in the world is very difficult, and we need to take care of ourselves and each other. Another one that I think is invaluable, I recommend it highly often, is the set of books by Kathy Steele, Suzette Boone, and Anno Vanderhart on treating trauma-related dissociation and for the therapist and coping with trauma-related dissociation. So if you're working with or you are dealing with trauma and dissociative identity disorder or some other severe dissociation, just tremendous resources. Another tremendous resource that I recommend for therapists and clients is my therapy cards, created by Black psychologist Ebony Butler, specifically for Black women. And then she's since released a set designed for Black girls and another for Black men. And so it can be used while you're in therapy, as part of therapy, or before preparing for therapy. It's a really great resource. And then finally, Consent as Tea. It's a short video on sexual that I like to show to sexual assault survivors, especially if they're expressing any guilt or shame. And it's also great for educating about consent for any young people as part of sex ed. And I actually got my kids' schools to officially adopt it as part of their curriculum. Just search it on YouTube, Consent as Tea, wonderful resource. Those are my go-tos, my faves.
Yes, thank you so much. I appreciate that and love the range. And that social support is so key in helping us to get through challenges and just everyday life. And Usha.
Yeah, I agree with all of that. I'll just name a protective factor for the sake of time. One thing that comes to my mind is just helping someone connect with something they love. Like sometimes it's a connection with someone, but sometimes it's also internal. It's something that they have lost touch with, that they just loved in their life. You know, it could be a passion, an interest. It could be something that is just theirs. And I think that's really, really important as a protective factor.
Beautiful. Because, you know, as soon as you said that, what I thought of is quote by Howard Thurman about do the thing that makes you come alive. And, you know, when I'm in touch with what I love, what brings me alive, it definitely is healing. And Robyn.
Yeah, I love that. I would second all of the books and resources that Carolyn mentioned, but also would add two. So one is your book, Thema, Thriving in the Wake of Trauma. I recommend that all the time. I use it as a resource in my own work often. So that's a great resource that I think everyone should have on their shelf, as well as Judith Herman's Trauma and Recovery. That's another one that, you know, in teaching and doing clinical work, I'm always referring back to, and think it's very user-friendly as well. So I would recommend those two, in addition to what Carolyn mentioned as far as resources to support the work that we're doing.
Wonderful. Well, I am so grateful to all three of you, and easily we could have like a weekend retreat and just keep going. So this has been just such an informative hour, and I'm grateful for you and your time, especially during these challenging times. It means a lot that you all were willing to be here. And thank you to those in our audience, both those who are live and those who will catch the replay. Glad that you're a part of this Wellness Wednesday series. And keep following to find out what our next conversation will be at themaforapa.com or our YouTube and Facebook pages. Thank you so much, and be well.